Welcome to News Network, the real doctors of Yo City. In this episode, we'll be focusing on pharmacogenetics, which is the study of inherited genetic differences in drug metabolic pathways, which can affect individual responses to drugs.
Pharmocogenetics is a term that can be used interchangeably with the term pharmacogenomics, which studies the traits of inherited genes and the responses they have.
Despite recent advances in discoveries, pharmacogenetics actually has a very long history dating all the way back to 510 BC, where Pythagoras discovered that fava beans have potentially fatal effects on some, but not all, individuals. I was going to make a terrible pun after that, but I decided not to. Continue, Sir Isaac.
Pharmacogenetics has recently become an important topic to cover due to its advances in Human Genome Project. Genetic medicine may very well make its way into healthcare, as it's been giving patients the exact and correct amount of medication they need and very well made the most viable solution.
Yes, you see, one of the most prominent programs of this would be PGen for kids, which is St. Judas Hospital's program. You see, this program allows the doctors there to give children with things such as leukemia or cancer the correct amount of medicine for their genetic differences. Continue, Sir Isaac.
Pharmacogenetics isn't a perfect science, however. There are theoretically countless enzymes in the human body, and there's only a few that we can currently analyze as they're the only ones that we know of and know how they work. The best way that it's done in the past has been trial and error. However, the study of pharmacogenetics has helped give patients like our patient over here, Jason Saunders, a new and viable solution to leukemia.
Goodbye, Jason. Yes, you see, Jason is a 10-year-old boy diagnosed with leukemia and was unable to receive the usual chemotherapy. Why? Because, you see, Jason is one of the few individuals on this planet, 10% of Caucasians actually, who are unable to undergo this specific path of chemotherapy. He was born with a genetic variation that reduces his ability to metabolize thiopurines, which means that rather than having two versions of TPMT, the enzyme in question, Jason only has one.
Dun dun dun!
Now, this would be a problem if not for our advances in pharmacogenetics. You see, through a test given based on how he might respond to the drug, Jason was able to be given the proper amount of TPMT needed for his system and enough so that he would not overdose. Thank you for tuning in to our news network, the real doctors of Yo City, right here. We'll be back another time later in the future to diagnose your problems. The love doctors are here, and we're ready to help you. But for right now, pharmacogenetics is our passion. Goodbye.